Welcome to the Natural Parents Podcast, where we will cover all things faith, health, family, and wealth through a biblical perspective of putting things in life that matter most back into order. We're reminded of Matthew 6:33, where Jesus said, "But seek first the kingdom of God and his righteousness, and all of these things shall be added to you." Join us each week as we focus on what truly matters most in this life and passing those values on to the next generation. This is the Natural Parents Podcast with Ryan and Abbie.
All right, guys, welcome back to another edition of the Natural Parents Podcast. We are very excited today because we get to talk with the Chiro Doula, Dr. Marlee Coleman, all about things faith, health, family, and wealth, but through a lens of perspective of kind of natural approaches to both our children and pregnancy, prenatal chiropractic care. We're really excited about that. So, Dr. Marlee, tell us about who you are.
Okay, so I am originally from Connecticut, and I think it's so funny that I ended up here because never been to Missouri. I definitely thought wasn't going to be here. I assumed all Missouri was everything, closest grocery store 30 minutes, cows, land everywhere, no life in Missouri essentially. So the fact that I'm here now is quite interesting, but it grew on me. I'm originally from Connecticut, came here for chiropractic school, grew on me in the 3.5 years that I was in chiropractic school, and I decided to stay. I definitely originally didn't see pregnancy and pediatrics in how I wanted to practice chiropractic. But I pursued doula work prior to becoming a chiropractor, and I just saw how everything ebbed and flowed and really connected together, and I just meshed the two worlds together. So, yeah.
That's amazing. And so what made you interested in being a doula before, while you were in school and stuff?
Yeah, so I had the opportunity to be a part of my goddaughter's birth. This was their second child, and the dad had passed out with the first birth. So the mom didn't even want him in the room this time around. She was just you were basically a waste of time. You did nothing for me, so you're not even allowed to be in the second birth. So I had the opportunity to be a part of it, which was so great. I had never experienced birth in any capacity. I never watched any videos, so I really didn't know what I was getting myself into. I was just excited to hold my goddaughter at the end. That's really all that I was looking forward to. And it ended up being a fairly traumatic birth, and just a lot was going on. Nurses, doctors were just yelling and not really explaining things. And at one point, the mom had looked at me in fear and was definitely looking for some sort of help or answer from me that I didn't have. I was just as scared as her because I didn't know what was going on. Everyone ended up happy and healthy, fortunately. But in that moment, I had this epiphany of if she went through this, surely other moms go through similar, if not the same exact experience. And I just knew I wanted to be more prepared, and I just wanted to know more to be able to be of help and be a resource for any moms that were going through something like that. So that's what inspired me.
That's awesome. What was it that then made the correlation? You're going through chiropractic school at the time.
Mm-hmm.
Not a lot of people initially think of infants for sure, but also even pregnancy. We hear that sometimes, is it safe for a pregnant woman to get adjusted and stuff like that? So how were you able to draw that conclusion? And then what are the benefits there?
Yeah. So my first client was in chiropractic school, and doula client. And she, in going through everything with her, she was just telling me how much chiropractic has helped her. And honestly, at that point, because they don't really touch on it in chiropractic school either. So it was kind of a new concept overall to me through her, and her sharing the benefits from me or to me, just in terms of how it's helped, the basic low back pain and discomforts that she was having, but also her morning sickness that she had throughout her first trimester, and her acid reflux that she was struggling with, even her swelling that she was, having difficulties with. So through her lens, I was able to really see and learn the benefits. And then not having adjusted an infant yet, she asked me to adjust her baby after her baby was born, as her doula. And I was like, yeah, sure. It's small thing. Surely big people can get chiropractic care, little people can too, right? So that was my first experience with adjusting a baby, and just to see the benefits again through her lens of just through breastfeeding and colic and uh, constipation, all that kind of stuff with the baby too. It was really cool experience.
I agree. It's amazing, and what an honor that she had you check and adjust her baby after it was born.
I
That's
know.
amazing. And that makes me think of a time that and in a moment I want you to explain the difference of a midwife and a doula for those who aren't aware, because I know whenever we started looking into having our first home birth, we were like, I was like, okay, doula versus midwife, what is the difference and what are the roles and things? So I do want you to explain that in a moment, but that story just makes me think of a time that Ryan was called, and it just shows the importance of chiropractic for babies, especially after birth and as soon after birth as you can have. A midwife called him and said, I need you to get here. This baby's heart rate is very irregular, and I know that it just needs to be checked and adjusted. And to somebody who's never heard of first a chiropractic for babies at all is like, what? And then second, like, wait, it can help heart rate and it can help, babies who are having distress after being born. And so we went, and I think I can share this part. Funny enough, it was in a hotel room, because where this mom was from, she was not allowed to have home births, and so they had it in a hotel room.
Wow.
And so I was with him, and I got to go, and he checked and adjusted this itty bitty brand new baby, and immediately was back into sinus rhythm, which is normal heart rate and normal rhythm for a baby of that size. And so just so cool to see how when the brain and body are connected and properly communicating, what can happen with that.
Yeah, I love that. I think I always tell people, like, babies are truly the epitome of chiropractic in my mind, just because, they can't communicate that they have the back pain and the neck pain and the headaches and all that kind of stuff. So in adjusting them, we're truly able to see functional difference, which, is what chiropractic is all about. So I love that. Thank you for sharing that story. So difference between doula and midwife, because many people do mix the two together, and we are very different. Midwives are more so the natural minded, but still medical providers. They have those years of training in terms of delivering babies. And even though I have experience delivering babies, not intentional experience, but happenstance experience delivering a baby, which we can talk about at a later point. That's not our training. That's not what we are supposed to be doing. We are simply the advocates for women, for moms, for partners, in terms of just being more educated and knowing what to expect through childbirth, providing different resources. And, I think specifically in hospital settings, in the midst of labor, you don't always know how to or when to advocate for yourself. And doulas provide kind of serve as that middleman to be able to advocate on behalf of the moms and the partners.
Yeah, and which is so important, because in the moment, mom and dad are caught up in emotions and feelings and focus of contractions and things. So do you have to have a natural birth or a home birth or any kind of birth for a doula, or is there options there?
Yeah, you can have any kind of birth. I think the hospital is a more common setting for a doula, because when you're having a home birth, you're already more natural minded, typically a midwife, and you are on the same page. And a lot of times there's sometimes there's just a divide between what you're wanting and what your OB is wanting in a hospital. But doulas can attend any kind of birth.
Yeah. And what would you say are like the three most important things for an expecting mom to prepare to not only think about the birth that she wants to have, but then also like the most important things that she can have on hand or do for baby once they're here?
That's a good question. I always suggest that moms and parents just do their own research. Like, it's so easy to be persuaded by your provider one way or another, and they may only provide one side. So like, do your own due diligence and do your own research to truly make informed decisions on what you're wanting for yourself and also for your baby once the baby is here. I also just think, in terms of things to have on hand, I am always open to giving a lot of my mom's just articles to give to their providers, because in my experience, whenever there is like a disagreement or backlash from your provider in terms of what you're wanting, and you hand them the articles, one, they may not even bother reading it, but then they'll just take your side because there's like a, actual physical paper taking the parent side as opposed to the OB side. So nothing against OBs whatsoever. It's just, have hard copies of what you're wanting to do. Sometimes they just need that. So.
Yeah, and I get that completely, because sometimes, like you said, nothing against any of the providers, midwives, OBs, anything like that. They just have their way of doing things, and sometimes that is because it's the best way. And so sometimes it just needs to be a discussion that needs to be had, because while we understand that might be in your clinical expertise, what you think is the best way, this is just something we really truly desire for the health of me as, well, not me, but the woman as the mom, and then the child that is being born too. So parents ultimately have that decision to be made. And so I think it's awesome that you provide them with resources, and parents, don't forget, there are resources out there you can find. And there's people like Dr. Marlee who can provide you with good resources of anything that you might be looking for. So
yeah. And I think that something that's just really helpful, I've talked with just since having the girls and stuff just over time, when we were doing our research, like thankfully somebody came to us and was like, you need to think about eye drops, vitamin K, circumcision. Like, you need to think of these things that are the decisions right after baby is born, because if you don't, they decide for you, and not in a malicious way. It's just their practice. And so if we hadn't been given that advice, and we also had research on hand to back some of the decisions, and we had to meet a lot of backlash, like hardcore worst case scenario, multiple providers coming in. And if we hadn't been prepared for that, I don't know what would have been administered to our girls, because that was whenever we had the girls, we had them in the hospital. And it just is so good to have a birth plan and be prepared for every scenario possible.
Yeah.
I want to highlight that there, because it makes me laugh a little bit, because we're beyond it. But parents, you are your kids' advocates. So go in, get your resources, be prepared. You're their advocate. You get to make those decisions. Don't forget that. And not to parlay, but I think it's worth mentioning. You have things for parents like that, right? Like, I've seen your stuff where you have resources like the 1-page birth plan and different things like that, where it checks all those boxes, right? How can people get in touch with you to get those types of resources?
Yeah, so social media is a great platform. I definitely heavily use Instagram at the Chiro Doula, like we said earlier. Marlee Coleman is just my Facebook. But I'm also very much like an open book. I think a lot of people have this idea that, she's a doctor, like there's no way I can talk to her individually. But I don't know, I give my cell phone out freely to many people. Like, I want everyone that I serve to have it, to use me as a resource, even if I don't work with them directly. Like, there are just so many resources out there. And I know you say this statement all the time, Dr. Ryan, of like, I wish I would have known to be like what they say, because they can know. Sometimes they just need someone reaching out to them, or someone just providing, answering the questions that they do have honestly. So they don't have to say that, and that doesn't have to be their story.
I love that. And you have such a heart for that. And I love your heart in it, of serving people in the way you do. So it's very awesome.
For sure.
Well, cool. So you saw how to connect with her. It's at the Chiro Doula. Before we sign off, though, I got to know about this story that you just mentioned.
Yes.
Yeah, please.
Oh man, I will try to keep it short. But so initially, one, I usually like to meet with doula clients, first, second trimester at the latest. Third trimester is cutting it really close, just in terms of all the things that I want to talk about, typically before their birth. I was in Walgreens one day wearing a doula shirt. A pregnant mom was next to me in the aisle and was just like, "Oh my gosh, you're a doula! Like, I need a doula." And I could tell she was very pregnant at this point. I was just like, "Okay, yeah, like, what's up?" And exchanged numbers. Talked on the phone later that day, and she was due in like 2 weeks at this point. So again, we're cutting it really close. But we quickly went over everything and just my protocol and how I like to be notified and when she goes into labor and just all those things. So probably a week later, I get a text from her that says she said, "I think I'm ready to push." So like to me, in reading that, I'm thinking like, oh, she's already at the hospital. Like, okay, I'll meet you there. She's like, "No, I'm still at home. Like, I need to get to the hospital." So I'm like, okay, let me rush, because at this point, if you feel like you need to push, you're probably kind of far along. So I get there and she is propped up in a position that I can already see this baby's head, like full head of hair. This baby's head is already crowning, like it's already showing. And we're at her house. It's about a 20-minute drive to the hospital. So I'm like, okay, do you want me to call an ambulance? At this point, we're probably not gonna make it to the hospital. She's like, "No, like I really think we should try making it there." And very pregnant, very hormonal. Like, I'm not gonna argue with her. So we get in her car, we start driving. Probably like 5 minutes on the highway, she's just like, "You gotta pull over. Like, I'm not gonna make it." And like, mind you, again, doulas, we don't deliver babies. So like, I don't have anything sterile with me. I don't really have anything to catch this, nothing. Nothing. Very ill prepared for this. So I'm just like, pull over and do what? Like, I don't know what you are expecting me to do. Like, this is not what I do. She's in her own world at this point because the baby is coming fast. So we pull over. She just gets out. Again, I'm still trying to like ask her, "What do you want me to do? Is there a way that I can help?" She just like goes into a deep squat position, and like this baby is slowly coming more and more out of her. And I just like, get out, go to where she is and just sit below her. Cause I'm like, this baby's can't take its first breath on the pavement on the side of the highway. Like, that just seems awful. So sat down, the baby just plops into my arms. It was a beautiful experience, of course. Gross a little bit, I'm not gonna lie. It was a lot. It was
on
my body. Yes, on my body, on my face. Like, it was, I had to keep it together. And the baby was so slippery. Like, again, just had nothing to catch this baby with. And we proceeded to drive the rest of the way to the hospital. Her placenta, kind of gets delivered her placenta comes out as we're on our way to the hospital. We just show up to the emergency room, with baby in our arms, and, "Okay, can we get a room?" Like, baby's already here. We kind of skipped the whole process. But yeah, so again, that's not my training. Grateful for the experience. Probably wouldn't do it again. But grateful for the experience.
You can check that one off the list.
Now you're ready. Like, you're prepared. And
Right.
I have to add, this isn't just like a 2-lane highway. This is like a 4-lane, busiest highway in St. Louis highway that you had to pull over.
Don't know if anyone can see what's happening on the side of the road. I mean, we were just doing it.
Oh my gosh.
Okay, so you touched on it a little bit, but obviously not your most ideal stage of maybe the journey to meet a doula client, right?
Yeah.
But what about chiropractically? I mean, when should moms start seeing a chiropractor?
Oh, I mean, honestly, before they're pregnant, even, I think what's cool about seeing moms before they're pregnant and then as they transition into being pregnant is, one, because we take full spine x-rays, just having that on hand before they get pregnant, so we know what their spine looks like, and then obviously adjusting them through pregnancy, and then afterwards being able to see how their spine changes from pregnancy is really beneficial. But because we are so nervous system focused, I mean, it's never too early to start chiropractic care in general. Obviously, we're talking about pregnant moms specifically, but just in general, it's never too early.
Yeah. So almost as a lead up, right? Like you're thinking.
Yeah.
Not everybody has the luxury of, hey, we're thinking about becoming pregnant, right? But
right.
If you're in that phase, maybe it's a good idea to have that regulation and be getting checked, have your nervous
For
system,
sure.
all that stuff.
And so what is the, like if somebody's looking for a chiropractor near them that you can see pregnant women, it is important to differentiate that you would probably not go to a sports chiropractor in hopes to get a pregnancy adjustment. So what is it that they should look for to make sure that they are qualified and trained and certified to see pregnant women?
Yeah, great question. So I always lead people to the ICPA website, as that will give a list of specifically Webster certified chiropractors, which is super important when it comes to pregnancy care, because we have that additional training outside of just, chiropractic school, hours of training to become skilled in serving pregnant women specifically, and knowing how their body changes and the frequency of care that pregnant women need. Just all of that extra training is really important for Webster certified chiros to have.
Yeah.
I love that. Yeah, it is. It's great. And I think you are such a valuable resource to your community. I'm so excited that you were able to join us here, and we can share with the Natural Parents community some great resources, some funny stories, and an awesome person that you are. So guys, connect with her at the Chiro Doula, message her, check her out on social medias. I think, Dr. Marlee, we can't thank you enough for joining us here on the Natural Parents Podcast.
Thank you so much.
From the bottom of our hearts, we want to thank you for listening. If you enjoyed this podcast, please share it with someone you know and leave a review. By doing so, we're able to grow this community of amazing people just like you and raise a generation of children that know God and do His will on earth. We'll see you next time.